Every child will have an upset stomach at some point, and most often it's nothing serious. For mild abdominal pain, you can usually wait for your child to get better with home care remedies, but there are instances when it's important to reach out to a healthcare provider. What are the most common causes of stomach pain? The most likely cause of stomach pain is not eating enough, not going to the bathroom, or a combination of the two. In some cases, a specific problem such as constipation, heartburn, or a food intolerance causes abdominal pain. In other cases, the cause may not be so clear. An infection, stress, anxiety, or lack of sleep may make the nerves in a child's intestines more sensitive to pain. In some cases, the problem may be genetic, which means it runs in the family, and other family members might have a similar history of the problem. When should I call a healthcare provider? You should call your doctor if your child has stomach pain that lasts more than a week, even if it comes and goes, stomach pain that gets more severe and frequent, stomach pain that makes the child nauseous or vomit, stomach pain that does not improve in 24 hours, a burning feeling when the child pees, diarrhea that lasts for more than 2 days, vomiting for more than 12 hours, a fever over 100.4 degrees Fahrenheit, poor appetite for more than 2 days, or unexplained weight loss. In some cases, a tummy ache can be the sign of something more serious. Seek medical help immediately if your child is a baby younger than 3 months and has diarrhea or vomiting, is unable to pass stool or poop, especially if the child is also vomiting, is vomiting blood or has blood in the stool, especially if the blood is bright red or black, has sudden sharp abdominal pain, has a rigid hard belly, has had a recent injury to the abdomen, is having trouble breathing, or is currently being treated for cancer. How is stomach or abdominal pain diagnosed? A clinician will take a history of the child's stomach or abdominal pain. This includes how and when it started, the location and type of pain, and how it has progressed over time. If the child has any allergies or a history of food intolerances, parents should let the clinical team know. A healthcare provider may order tests of the child's blood, urine, or stool in order to rule out specific conditions associated with abdominal pain. If the child's medical history, exam, or lab tests raise further questions, more in-depth tests may be necessary. These can include an abdominal X-ray or even an exam called an endoscopy. An endoscopy is a test that uses a tube about the width of a finger with a light and a tiny video camera on the end called an endoscope. The endoscope is used to look at the inside of the digestive tract. Small samples from inside the digestive tract may also be taken. What is constipation? Constipation is a very common cause of abdominal pain in young children. It's a condition in which a child has a bowel movement or poops fewer than 3 times a week or finds pooping difficult or painful. Usually there is no medical problem associated with constipation, but there are some things that can add to the problem, like a poor diet full of high-fat, low-fiber foods, not drinking enough liquids, changes in diet such as a switch from breast milk to formula or beginning to eat solid foods, lack of exercise, emotional issues related to using public bathrooms, toilet training, or stress. Once a child has become constipated for some time, their stool or poop can become hard and dry. These stools can be painful to push out, and the child might avoid using the bathroom to avoid the discomfort. Eventually, their intestines will not be able to sense the presence of stool. If your child's constipation doesn't clear up with changes in diet and behavioral habits, see their healthcare provider. From first conversations to treatment, Boston Children's Hospital is committed to keeping children and adolescents healthy. For more information, please speak with your primary care provider or visit bostonchildrens.org.